Good evening and welcome to Chesapeake Public Schools Family Empowerment Webinar presented by the Office of Family and Community Engagement, or FACE. I am Lisa Carey, one of the FACE specialists. Our office, which is under the Department of Engagement, seeks to create meaningful partnerships in order to inspire, engage, and empower families, educators, and community agencies to support the initiatives of Chesapeake Public Schools. We are typically available Monday through Friday from 8 a.m. until 4 p.m. and can be reached by our main line at 757-482-5923, or you can reach us at face@cpschools.com. Thank you for joining us tonight to discuss addiction and the opioid epidemic. Before we begin, I want to let you know that this webinar is being recorded to share on our Chesapeake Public Schools YouTube channel. Participants' cameras and the chat feature are disabled. If you have any questions, please use the Q&A feature located at the bottom of this screen. We will answer all questions at the conclusion of tonight's presentation. Virginia is experiencing an opioid crisis in overwhelming portions. In fact, the leading cause of unnatural deaths in Virginia is a result of drug overdose. As a result of these alarming statistics, the Women's Chamber of Hampton Roads Chamber of Commerce, Chesapeake Integrated Behavioral Health, the City of Chesapeake, and Chesapeake Public Schools are partnering to provide a three-part series family empowerment webinar on addiction and the opioid crisis. This is extremely important for our families as opioids and other illegal street drugs are becoming more accessible to our youth. To educate and provide resources for our families, we have two guests. We have Dr. Pat King, psychiatrist from Meharry Medical College in Nashville, Tennessee, with over 30 years of experience. Additionally, Dr. King is affiliated with a number of community service organizations such as Delta Sigma Theta Sorority Incorporated, Norfolk Links Incorporated, the Women's Division of the Hampton Roads Chamber of Commerce, the American Medical Association, and the Greater Norfolk Medical Society, just to name a few. She also holds several leadership positions with Eastern Virginia Medical School, Friends of Hampton Roads, and Eastern Virginia Medical Schools as well. Dr. King has received many accolades, including Top Doc Award, Psychiatry, Hampton Roads Magazine, Community Philanthropy Award from Eastern Virginia Medical School, and the Martin Luther King Jr. Award from Old Dominion University. We also have joining us tonight Mr. Edwin Ed Gonzalez, Executive Director for Chesapeake Integrated Behavioral Health Center. Mr. Gonzalez has been with Chesapeake Integrated Behavioral Health, or CIBH, since 2015. He started as a Developmental Disabilities Program Director. The position evolved to be the Care Coordination Programs Director in 2017. In 2022, he was named the Executive Director of CIBH. He has vast experience in the field of behavioral health and developmental disabilities for over 35 years. Prior to working with the City of Chesapeake, he worked for the Department of Behavioral Health and Developmental Services for almost 17 years in a variety of capacities, with the last 8 years in the Office of Licensing. Born and raised in Brooklyn, New York, he is a die-hard New York Yankee fan. He is proud to call the City of Chesapeake home for 29 years. At this time, I'd like to turn the program over to Dr. King. Welcome, Dr. King.
Good evening, and thank you so much. I'm thrilled to be here with all of you. Thank you for coming out this evening. I know there are probably a million and one things you could be doing, but I'm glad that you're concerned about the community enough to sacrifice your time this evening. I do want to take just a couple of seconds to thank a few people and organizations. I do want to thank the City of Chesapeake and Debbie Ritter for helping me to organize this event, as well as the Women's Division of the Hampton Roads Chamber of Commerce course, the Chesapeake School Division and Dr. Cotton, our wonderful superintendent, and Dr. Angie Smith, and Chesapeake Integrated Behavioral Health. Thank you for all of your support. And to Lisa Carey, thank you for helping me get all of the slides together. This is a very timely discussion for us to have this evening. I'm just thankful to have had the last 30 plus years to help people with mental health conditions and people who suffer from substance use disorders. This is a very serious disease, and I think it needs our attention, and we need to be better informed about it. So today we'll be talking about addictions, mostly specifically talking about the opioid epidemic, some of the consequences of it, who it's affecting, how it happened, what's actually being done about it. We'll talk about treatment. And then Mr. Gonzalez is going to talk to you about some of the community resources that we have available. So when we talk about addiction, what exactly do we mean? Well, addictions are chronic, relapsing disorders. They're characterized by compulsive behavior or use, and a hallmark is the inability to stop despite adverse consequences. So when we say chronic, we mean long-term, difficult to ameliorate. Relapsing means it's recurrent, tends to be progressive over time. And as I said, the inability to stop is really a hallmark. What are adverse consequences? It may be a job loss. It may be the loss of family connection. It may be a health condition, but people continue to use. They may have pancreatitis from drinking heavily, or they may develop cirrhosis of the liver. But they continue to use the substances in spite of adverse consequences. So the DSM-5 is what I like to call a psychiatrist's Bible. It has all of the mental health conditions, symptoms, diagnoses, as well as all of the substance use diagnoses. And it is a pretty thick textbook, but it's very inclusive, and we pretty much live by it. So the DSM-5 actually recognizes 9 types of substance addictions. The sedative, hypnotic, and anxiolytics actually are classified as one in the DSM-5. So it looks like we have 11 here. But I want to actually name these because I think sometimes there's a misconception that these substances may not be habit forming or potentially addictive, when in reality they are. Alcohol, caffeine, cannabis, hallucinogens, inhalants, sedative, hypnotics, anxiolytics, stimulants, tobacco, and opioids. These are what is recognized by the DSM-5. Let me talk just for a second about hallucinogens, because that may be something now you're not terribly familiar with. But hallucinogens would include things like LSD, PCP, psilocybin, things that alter your perception of reality and can cause hallucinations. And the inhalant class refers to things like inhaling gasoline fumes, or inhaling glue fumes, or spray paint fumes. Those things also can alter our reality. And the sedative, hypnotic, anxiolytic class includes mostly medications that we use to treat insomnia. Some of those you may be familiar with, Ambien, Sonata. They do have some habit-forming potential. And then the benzodiazepines are also in this category. They are usually used for anxiety. They're used sometimes to help with sleep. And examples of those would be like Xanax, Ativan, Valium, Librium. And I think the other substance use disorders you're probably familiar with. Next slide, please. So why do we say this is an epidemic? Well, the opioid epidemic really refers to how widespread the use is and how much of a serious public health issue actually stems from not just use, but the rapid increase in use of prescription opioids as well as non-prescription or illicit opioid drugs. And we'll talk a little bit more about prescription opioids as well as some of the opioids that are sold in the black market, so to speak. So, who is affected by addictions and the opioid epidemic? It crosses all socioeconomic, educational levels, as well as it affects all races, all genders, and ethnicities. There are no lines drawn when it comes to addictions. Um, I have treated people who are highly educated, work every day in the corporate world, who have high paying jobs, and for their lunch break, they go into the bathroom and they shoot up heroin. Um, and then we have people who live on the streets, who are destitute, who are also strung out. And I also want to point out when we talk about all ages, I have even treated babies, infants who are delivered in the delivery room who are born addicted to substances, cocaine, heroin, babies who have marijuana in their systems when they're born. And due to COVID, we've seen rising numbers of the elderly who are suffering from alcohol addictions and other substance use disorders as well. So this crosses all lines. No one is immune. It can affect anyone at any time. Why do we care? There's a lot of talk about addictions. When you turn on the TV, you hear about it. Heard about it last night. We'll talk about what went on in Virginia Beach in August. But we should all care because this is an issue that's affecting all of us. It's killing our children, it's killing our friends, our neighbors, and people we love. Even if we are not directly personally affected by an addiction ourselves, we at least know someone or know of someone who has had an addiction of some type. We also know that drug use and addictions do affect the crime in our neighborhoods, and we all want to live in safe environments. So, another reason why we should be concerned about drug use. We have an overextended, overtaxed healthcare system with about 50% of practicing physicians approaching retirement age, including myself. And the overdoses and the number of patients that are being seen in the emergency rooms with overdoses and the number of patients that are dying of overdose deaths is really taking a toll. Our healthcare system is taking a serious hit. And not only that, when we talk about communicable diseases and the spread of disease, we have to look at substance use and drug addiction. Those people who are addicted to opioids oftentimes engage in high risk sexual activities, which predisposes them to sexually transmitted diseases. And also with IV drug use, like with heroin, people very commonly share needles, which contributes markedly to the spread of viral and bacterial infections like HIV. Um, and it really poses a very significant public health issue. So we should all care. We're all impacted in one way or another. So when we talk about genetic risk, because when we talk about addictions, we actually have to talk about genetic risk. And what do we mean by that? Genetic risk relates to what you've inherited in your genes or in your DNA, if you will, from your parents. We have no control over our genes, over our DNA. Basically, you get what you get. Some of it's good, some of it's not so good, but we work with what we have. We do know that family members of addicts have a higher likelihood of developing addictions. So we know that there is a genetic component to all addictions. So this is a very interesting study that was conducted by the National Institute of Health. And they didn't look at a small sample. They actually looked at over 1 million people, and they were able to identify genes that were commonly seen across all substance use disorders. So repeatedly, the same genes showed up with people who suffered from addictions, which really reflects on the connection between genetics and addictions. And also through research, we have discovered that about 40 to 60% of your addiction risk is in your genes. You're born with it. That doesn't mean that you're necessarily going to develop an addiction if you have a strong family history, because there are other factors that have to be considered as well, like environmental factors. But I think it's really significant when you look at 40 to 60% of your risk being tied to your genes. Patients often ask me about genes for alcoholism, and I think there are some misperceptions about alcoholism and genes, but through research, scientists have been able to identify genes that are associated with alcoholism. And those genes are in our chromosomes and our DNA, and they code for certain enzymes that break down alcohol. They're related to alcohol metabolism. And one of those enzymes is called alcohol dehydrogenase. Another is acetaldehyde dehydrogenase. And they play key roles in the metabolism of alcohol. And there's a strong correlation between the genes that code for those enzymes and the risk of developing alcoholism. So the answer to the question is, are there genes that to some extent determine whether or not you're prone to abuse alcohol? And the answer is absolutely, scientifically, yes. So, more interesting things about genetics. And the reason I think this is important to highlight is because I think sometimes we judge people who have addictions, and there's a stigma associated with addictions. But my point tonight is to show you that these people who suffer from addictions have, for the most part, a genetic predisposition that they had no control over. The mistake that they made was experimenting with substances. And the best way to avoid addictions is to avoid substances that are addictive. And I know that's hard for a lot of people. That's really the only foolproof way to avoid addictions, is to avoid addictive substances. So researchers have found specific genes repeatedly that they have identified in people who struggle with opioid, alcohol, and cocaine addictions. Researchers are using family history, to help identify family members through chromosomal patterns that are repeated in families to identify those who might be affected. So they look at the genes of those who are affected with addictions and the genes of those who are not, and they repeatedly find that there's similarities in those people who are affected in families. So hopefully, as science evolves, we'll be able to predict with some level of certainty who's at risk so that we can take the proper precautions and hopefully avoid some of these addictions. I think this is interesting because I hear a lot from my patients that marijuana is not addictive. It's legal. Just because something is legal doesn't mean it's good for you, and it doesn't mean it's not addictive. Alcohol is addictive and it's legalized. But researchers have been able to find two very specific areas of our DNA that contribute to the increasing risk of developing dependency on marijuana. And there is a subset of people who do become dependent on marijuana. Not everyone. There are people who can drink socially for years and not have a problem. There are people who can smoke marijuana for years and not develop a dependency. But there are those people in both areas that will develop a dependency. So data from the Adolescent Brain Cognitive Development Study. This is an organization that does research on children's brains and children's health. It is the largest and longest running organization that does this type of research. And what they have been able to accomplish is the identification of children who are likely to develop an addiction to marijuana. And through this research, they're able to look at, because they use PET scans to look at actual brain structure, and they're able to identify high-risk children by looking at the white matter of their brain. That's like the covering surface area of the brain. And what they have found is that the children who have low white matter volumes appear to have a higher propensity to develop problems with cannabis, more likely to be vulnerable to cannabis use disorder. I think it's great that this research is ongoing because I think it's going to help us to avoid a lot of addictions in the future. And it also will give us insight into treatment options, how better to treat people who suffer from some of these horrible illnesses, the illness of addiction. So what other risk factors? We said genetics accounts for about 40 to 60% of one's risk of developing an addiction. What about the other 40 to 60%? Well, those are the environmental factors. So there are two factors. It's your gene pool, what you got from your parents, and then it's your environmental factors. So who are the people who are at risk, and what are the environmental factors that contribute to this? Well, we know that people who are living in poverty, people who live in high crime areas or low income neighborhoods, people who are suffering from physical or mental pain, persons who are suffering from mental health conditions also have a higher likelihood. Children, adolescents, and teens who are poorly supervised by their parents, and also frequent high risk exposure to people who are using substances. And so I'm going to stop here to say, because I frequently hear from teachers now that marijuana has been legalized in the state of Virginia, that the kids are coming to school smelling like marijuana. They don't know if it's because the parents were smoking on the way to school, or if the kids themselves are smoking. But there's liberal use now of marijuana. And what the studies do show, not Dr. King's personal opinion, but what the studies show is that these kids who are being exposed, whether it's alcohol, marijuana, or opiates, early on, have a higher risk of abusing these substances. So in order to protect our children, we need to minimize their exposure. Also, there's a multiplicity of information available about the impact of marijuana on developing brains. And for some of us, brains don't completely develop until young adulthood. The studies are profound and very interesting. So I'm giving you the research and the data. And so we have to make decisions accordingly. When we're informed, we should make better decisions. Next slide. When did this happen and why did this happen? This actually goes back to about 1995 when OxyContin, which is an FDA-approved medication for the treatment of pain, hit the market. And it was marketed as a medication that was great for addressing pain, that it was supposedly not addictive. And so prescribers, doctors, dentists began writing prescriptions pretty liberally for patients, thinking that it was a helpful medication. Since then, we have found out otherwise, but that was the first wave of abuse of opioids and the beginning of opioid epidemic. And so there was a second wave that occurred in the early 2000s, about 2007, when heroin became fairly widely available. And it was an option for people who were already addicted. They didn't have to get a prescription from a doctor. And the substance was pretty easy to obtain. It was sold illicitly on the street. And it became a really big problem in the early 2000s. And then we had a third wave, which happened about 2013 when the synthetic opioids became a big issue on the streets. And by synthetic opioids, we mean those that are made illegally. And they just continue to escalate in use. And it's evolved into a major issue with something called fentanyl. And the thing about fentanyl that is tricky is that it is FDA approved to treat pain as well, but it is very, very potent, and it can be very, very deadly. And so we've basically had three waves that have contributed to where we are today with this opioid addiction. We do know that COVID-19 resulted in an increase in alcohol use and drug use disorders. Absolutely, that's in the research. But as physicians and prescribers, we have to take some responsibility because we have been liberally prescribing pain medicines in an attempt to try to help patients who were in need. So addictions don't just affect an individual, they affect everyone around them. They affect everyone who cares about you, everyone who loves you. How does it impact families? Relationships are oftentimes disrupted. Um, Oftentimes, marriages are dissolved, there's separations, divorces. I have seen families expend their entire 401k to get treatment for a family member who has an addiction. The financial losses can be tremendous. I've seen people take out second and third mortgages on their homes to help their kids or sister or brother or parent who's suffering from an addiction. And not only that, but our safety and our security is threatened because we know that there's criminal activity that surrounds addictions and drug use, especially when it comes to opioids like heroin and pain pills. And so it really threatens your level of safety. Oftentimes, when drug deals go bad, um, the drug dealers come after the family members, not necessarily the person. So it can be very dangerous for everyone who cares about an addict. When it comes to our children, um, it's actually very scary because a lot of these children are neglected. They're more likely to be abused. They tend to not be supervised at home. And they themselves, as we said earlier, are more likely to become addicts in this type of environment. So everyone who loves an addict is affected by their drug use and their addiction. They all suffer a hardship of one type or another. So let's talk about statistics. I was a math minor, so I like numbers. So let's talk about numbers. Excuse me. Um, in 2021, in the United States, there were over 107,000 overdose deaths. The vast majority of them, 75%, involved opioids. 37% involved combinations of stimulants and opioids. And if you remember early on, we talked about stimulants, cocaine, Adderall, Ritalin, medicines that are used for ADHD. So I think that's really significant to know. The number of overdose deaths in 2021 was actually 6 times what it was in 1999. So that tells you about the progression of this disease and this epidemic. And this is a startling number, 46 million people, not 46, not 46,000, 46 million people in 2021 over the age of 12 have been diagnosed with a substance use disorder. This study came out of Washington University School of Medicine, and they warned that with the legalization of marijuana across the country, that we can expect to see an increase in addictions. And the research suggests that about 20% of marijuana users will develop an addiction problem. 80% will not, but 20% is a significant number. Where are these illegal opioids coming from? Well, about 90% is coming from Middle Eastern countries. And they're not coming to be prescribed by physicians and distributed by pharmacists. They are destined for the illegal market. When we look at the states that have the highest number of overdose deaths, West Virginia, Washington, D.C., Virginia tends to be kind of in the middle. There's a study out of Stanford University Medical School that reports that teens and young adults who receive opioids, a lot of times they're receiving the first opioid for wisdom teeth extractions. So they're receiving them from their dentist or their oral surgeons. They are at increased risk of developing an opioid addiction that following 12-month period. And 5% of teens and young adults who were prescribed opioids for the first time went on to abuse opioids. Also, every decade since 1900, we have seen an increase in the life expectancy. So people are living longer and longer because of the advances in medicine, the treatment that we have, early detection, so forth and so on. But what we are experiencing now since 2020 is actually a decrease in life expectancy. And a lot of that we believe is attributed to the young people who are dying of drug overdoses. COVID-19 has also played a part in that as well. Let's talk about Virginia. What is happening in Virginia? Well, in 2016, the state health commissioner and the Virginia Department of Health declared a public health emergency due to the addictions that are affecting the health and the safety of Virginians. That was followed up by our Attorney General, our current Attorney General in 2022, Jason Miyares, who launched a public awareness initiative, One Pill Can Kill, to help address the opioid epidemic in the state. It's awesome to know that our leaders understand the significance of addressing this epidemic. Kudos to Attorney General Jason Miyares. Overdose deaths have been the #1 cause of unnatural deaths, not just in 2023, 2022, but since 2013. 98% of fatal fentanyl overdoses in Virginia were caused by illicit, not prescription versions of the drug. So that tells us that fentanyl is being sold illegally in the black market. People are not dying because of the doctors or prescribers' prescriptions. It is on the streets. I'm going to talk a little bit more about fentanyl. Virginia has one of the highest prescription rates for opioids in the US. I think we're going to be seeing those numbers change drastically. And any of you who've been treated for pain or know of people who've been treated for pain, even people who are on stimulants, you know that prescribers are really cracking down on the amount that they're distributing and on the prescriptions. And because there have been so many deaths connected to both stimulants and opioids, it's not as easy to get those prescriptions filled. And I think that's a good thing. We really need to protect the public and their health. That's our obligation. In 2020, we had almost 10,000 emergency room visits for overdoses. That was up from 2019, 33%, significant percentage. We had about 1,500 overdose deaths in 2020, and that was up 17% from 2019. So you see how the percentages are rising pretty incredibly from one year to the next. It's estimated that 2 Virginians die every day of prescription and heroin overdoses, and I know that number is extremely low. Just yesterday on the news, they talked about Virginia Beach, and in the month of August, which hasn't even ended yet, there were 33 overdoses, and 8 of them were fatal. That was in the month of August. So we know that that number is a very low number. In 2021, there were 18.2 fentanyl deaths per 100,000 population. That's up from 0.4 per 100,000 in 2011. So in 10 years, from 0.4 to 18.2. I also want to say a lot of times you hear people pronounce fentanyl as fentanyl. The correct pronunciation is fentanyl, not fentanyl. Next slide, please. Some of these you may be familiar with. These are different types of opioids. All of these, except heroin, can be obtained through a prescription. OxyContin was the one that we talked about that was approved in the early 1990s that significantly contributed to the opioid epidemic. But Percocet, Dilaudid, morphine, fentanyl, Vicodin, codeine, hydromorphone, heroin, all types of opioids that do have addictive potential associated with them. So now to talk a little bit more about fentanyl. Fentanyl is actually an FDA-approved medication for the treatment of pain. It has flooded the black market. It is deadly in very small amounts. If you can imagine 10 grains of salt, that is a dose that would be deadly. Fentanyl can be laced with marijuana. It can be put in heroin. It can be in tablet form. But a lot of the deaths that we're seeing, and especially those 8 deaths that we're seeing a few days ago in Virginia Beach, we believe are related to this substance, fentanyl, very commonly seen in overdose deaths. So what do you see when someone overdoses on opioids? ill. That's because they have respiratory depression, so they're not breathing well, which means they're not oxygenating well. That can lead to purple fingernails or purple lips. We say people are cyanotic when you start seeing the purple discoloration. They can be clammy or damp to the touch. They can be limp. You can hear oftentimes them gurgling or vomiting. They're oftentimes unable to be aroused, and pinpoint pupils are also a telltale sign of an opioid overdose. What kinds of treatment options do we have for people who've experienced an overdose? And you're probably aware naloxone has become widely available to reverse the effects of an opioid overdose. There are different ways to administer this naloxone. It can be inhaled, it can be injected into a muscle, it can be injected under the skin. We say that subcutaneously, or it can also be given IV. It rapidly reverses the effects of an opioid overdose, and it has been responsible for saving thousands and thousands of lives. What are some of the treatment options? Methadone used to be the mainstay, the gold standard for treating people who had opioid addictions. People had to go to a methadone clinic every day. They had to check in. It was very tightly monitored. It still is. But over time, the restrictions on it have loosened a little bit for people who have been on it for a long time and they've been steady and compliant. Suboxone is oftentimes used too. It's becoming more popular. It is a form of buprenorphine, and it's buprenorphine mixed with naloxone. So people don't get the high or the buzz that they typically get from opiates. It also decreases the craving for opioids, and it decreases the likelihood of withdrawal. And if it is monitored properly, it can be a very effective tool in addressing the opioid addiction. And it can be prescribed by a doctor in an outpatient setting, and they can go to the pharmacy and get it. Is there some addictive potential associated with buprenorphine combined with naloxone, which is Suboxone? Of course, there is, but we believe it's minimal as it relates to actually using street drugs or some prescription painkillers. All of the treatment options should be combined with a comprehensive treatment program. That means therapy, going to group therapy sessions. And so there's not just a pill or just an injection that is a cure-all, but it is a comprehensive treatment program. So in summary, addictions are very serious. They are widespread. The use of opioids has become increasingly more widespread over the last few decades, and it has caused a serious, devastating crisis to our communities and our families. Addictions are largely determined by our genetic predisposition, although we know there's an environmental component as well. Addictions are seen across all economic, socioeconomic, educational, racial, and ethnic backgrounds. It does not discriminate. The families of those affected do suffer tremendous hardships due to the addictions of those who they love and care about. The FDA-approved medications to help addicts recover have saved lives. And it's a great thing that today we have options for treating these patients. We all as a community do have a part to play in containing this serious and deadly epidemic. And all of you who are here today are off to a good start because your presence tells us about your interest and your commitment to your community. I want to thank all of you for being here this evening, taking the time out to hear this. And I want to introduce to you Ed Gonzalez from Chesapeake Integrated Behavioral Health, and he is going to provide you with some community resources.
Thank you, Dr. King. I have to say, wow, talk about valuable information that's so critical to our youth and our families. Thank you for the information to us, and I'm here really intent, very listening to the information, it's scary, but this is where we're at. It's about educating our youth and our families of this. These are the critical needs that are happening in our community currently. First, I want to thank you very much, as a physician, as a psychiatrist, for you taking your time and developing this training and this information to share. It really is invaluable to our community. So thank you. I want to thank Lisa and Tawana Chesapeake Schools for inviting me to speak in terms of what are the resources. So here we are, we got all this information. So what's next? The resources that we provide at Chesapeake Integrated Behavioral Health Care, we're a component of the city. We're a city department, and we are, as part of the Community Services Board and Behavioral Health Authority system, as the point of entry of services, publicly funded behavioral health and developmental services. And so in terms of service needs, identifying where to go, we are that resource. We partner with the schools, we partner with community partners, we also collaborate with the hospital. So what can we offer? We basically are located at 224 Great Bridge Boulevard. Okay, and one of the primary resources that we provide is same-day access and engagement. And same-day access helps individuals obtain mental health, intellectual disability, and substance use disorder services at CIBH. Instead of scheduling an intake appointment in advance, you could walk in between the hours of 8:30 and 2 o'clock, and you will be seen by a licensed clinician who will do an assessment and determine, hey, these are based on your needs. These are the services that you may, based in terms of what you're coming to us, where we could basically link you. If it's a service that we can't provide, we will let you know these are the community resources available not only in Chesapeake but throughout the Tidewater. One of the things that we do in terms of collaborating with the schools is we have prevention services where it's our prevention team is designed to empower individuals, families, and communities and systems to meet the challenges of the life events and help with regards to identifying what needs are. And we go out and do trainings. We do Revive training, which realistically speaks to training individuals, families with regards to the signs of overdose or folks basically involved with substance use. And mind you, this life-saving training, because that's what it is, we provide naloxone, which Dr. King talked about. At the end of the training, it's between an hour and a half, and it is an invaluable training for families to basically participate. It's something that we could coordinate with the schools. It's something that we offer or throughout the year during our local libraries. And I'll be more than happy to provide additional information related to that invaluable training to families. Just also, our prevention team does a lot with regards to community trainings. They go out and do, there is also, abuse of cigarettes and nicotine. And they do have an initiative to going out to all different merchants to assure that cigarettes are not being sold to underage kids. We also provide psychiatric services, which we provide evaluations, ongoing medications, management, and nursing services to adolescents and our children. One component piece that we do offer, it's 24 hours, 7 days a week, is emergency services. This is a mandated program that provides mental health pre-admission screenings for hospitalizations or individuals in crisis and consultation. As well as, remember I talked about we could do same-day access and assess. Part of the resource that we provide is also outpatient services to adolescents be it telehealth or in person. Part of the treatment modalities that we offer is motivational enhancement groups, intensive outpatient groups, recovery maintenance groups, and dialectical behavioral therapy. And these are all component pieces with regards to outpatient services that we provide here at CIBH. We also have case management services where, hey, we assist individuals and families with regards to the resources that are available to the community. We are here every day. And again, my thing is this. So if it's something that we can't provide, we will assist you in locating resources in the community for you. We're one of many in the community. And it's not like, oh, we have to do everything. The most important thing, we're very person-centered. If it's something that we can't provide, we will assist you in locating those resources for you in the community. Okay. Lisa, this is back to you.
Thank you, Mr. Gonzalez. I really appreciate that. And again, families, I just had the QR code, which will give you the resource guide that you will need. Thank you, Dr. King and Mr. Gonzalez and the City of Chesapeake for allowing us to present this very informative webinar and for your wealth of knowledge. And so, do you have any questions with tonight's webinar? Here is a list of resources that you can contact to find more information, or we can send you into the right direction. At this time, we'd like to open up the floor for Q&A, and I have a few questions in the chat. And so Mr. Gonzalez or Dr. King, either one of you can answer them. And so the first question I have, they said, I've seen the naloxone training at Chesapeake Public Libraries. Does CPS offer this training? And I don't know, Mr. Gonzalez, do you guys offer that training? I know.
Yes, that's that Revive training that I was mentioning about. That's what it is. It's an hour and a half training. And realistically, it teaches the signs with regards to someone who may have overdose, as well as it teaches how to basically administer naloxone. Once someone goes through that hour and a half training, we provide, at least this is based in terms of a grant that we've gotten from the Department of Behavioral Health and Developmental Services. We provide the naloxone. We have a safety bag that we provide to participants of that training, and we're always doing these trainings, so you can always look out as to when the next one is available.
All right, great question. So the next question was, one pill can kill. Does CPS have posters that can be put in schools with some of these overwhelming statistics? And so we are currently working on that with, as that is mandated by the state. And we do have Narcan available in our schools that it's administered by the school nurses. So we are actively making sure that we have all of these things in place so that the schools are aware, the families are aware, and the students are aware. Okay, I have a question. I'm nervous about my child being prescribed an opioid for an upcoming surgery. Any advice for that?
No, I'll answer that. My advice would be, one, to ask the prescriber if there are any other non-opioid options for managing the pain. That would be the first thing. If there are not adequate alternative options, my suggestion would be to use as little as possible for the shortest period of time possible.
All right, great. The next question is, what kind of questions should I ask my doctor if I'm prescribed an opioid for pain?
Okay, and I'll answer that one. Well, I think you want to know definitely what the opioid is, what the side effects are related to it. Once again, are there any other alternatives to an opioid for addressing the pain? There are people who do have significant pain and they do deserve relief. There's no question about that. But we want to try to minimize the use of these opiates, and we want to find alternative ways to treat. There is some research that shows that combinations of ibuprofen and acetaminophen after dental procedures can be just as effective. So I would ask that prescriber to go over any other options that are available. And I would try to avoid using an opioid if at all possible. And at the same time, we don't want you to suffer. If you have to use an opioid, once again, the least amount possible for the shortest period of time possible.
Okay, great. Thank you. And how long should I take an opioid before I can be considered an addict?
That's a good question, and it varies from person to person. I've had people tell me that they took their first pill and they already knew they were going to have a problem with it, that immediately it started them into a spiral of wanting more and taking more. I have patients who have taken low doses of opioids for years before they develop a dependency on it. And that's why I think it's so important that we avoid, whenever possible, any exposure to opioids. So there's no quick answer to that. It's very individualized. It depends on your metabolism, your family history, what the opioid is. So there are a lot of questions there that would make it, almost impossible to give you a specific answer.
All right, great. Thank you. So I have another question, and I guess that will be for us. It says, what measures are we taking at elementary schools to help our kiddos avoid experimenting? So currently we have several programs. This is one that we, have for our families. We also are having a family empowerment with Johnny's Ambassadors, which is another program that CIBH is sponsoring with us. And we have a session that's geared for our parents and for middle school students. As we're seeing the trend in middle school, we're trying to reach that population at first. And we're also heavily relying on parents attending our webinars to inform those elementary students. All right, that was a great question. And the last question I have for right now is, if I have a family history of substance abuse, where should I go to seek assistance to ensure that I don't follow the same path?
Mm-hmm. I'll answer that question. You are your best advocate. So if you know that you have a strong family history, it would behoove you, and it would be good judgment on your part to avoid addictive substances. We say it's 40 to 60% genetics, it's the other 40 to 60% environment. And from person to person, those percentages can vary. And so my recommendation to young people and to the person who asked that question is avoid addictive substances.
Excellent question. And then, so the last one that I have for this evening, I think, is, where should we dispose of extra opioids? So when they're finished with the opioids, where should they dispose of them so that they're no longer in the house?
I know that if you go to your local pharmacy, many times, I know Walgreens has a disposable medication. I guess trash. You could dispose of it. There's also at CIBH, we also have these disposable medication bags that realistically we give out to the general public when we do community fairs and when we're out. I think some of the libraries have these little bags that you could basically dispose, shake, add a little water, and it disposes it. So that's one option. Dr. King, I don't know if you know another resource.
Periodically, the cities in the 757 will have locations where you can take unused prescriptions to dispose of them. And so I would take advantage of that too. Controlled substances really can't or shouldn't go back to the prescriber. So you cannot return them to your doctor or your provider. But periodically, there are opportunities to turn in unused medications.
Okay, thank you. I think that's all the questions that we have for now. I don't see any more in the chat. So this concludes part one of addiction and the opioid epidemic. Please be on the watch for part two, hopefully later this fall. Again, I would like to thank the City of Chesapeake, Chesapeake Public Schools, CIBH, Dr. Pat King, and Mr. Ed Gonzalez for being a part of our panel of experts for this evening. Please remember that this webinar has been recorded and will be uploaded to our Chesapeake Public Schools YouTube page within the next several days. Thank you for joining us, families. And remember, families and communities work better together. Thank you and have a great night.